thanks everyone for joining our session today, which we've titled Laying the Foundation for Your Benefits Plan with Data Analytics. And as we first started developing the content for today's discussion, we started with a concept that Doug introduced to both of us around building a house and using a home security system, where in order to have a successful benefits plan, you need a foundation, you need support, guidance, and ultimately monitoring to ensure you're providing members with the most impactful experience. At Siemens Energy, this concept has changed the way that they look at employee health plans. And we'll walk through this concept today and really hear how Doug is challenging the status quo with their benefits. I'm Jennifer Jones, Population Health Practice Leader at Springbuk, and I have the absolute privilege today to be presenting with Doug Peddie, Head of U.S. Benefits at Siemens Energy, and Anthony Marino, Strategic Account Executive with Alight. Gentlemen, thanks so much for joining me today. All right, to set the stage and to help you all better understand each of our unique roles, we'll provide each of you a quick overview of our individual companies. So Doug, let's go ahead and kick it off with you, please.
Siemens Energy is the roughly 10,000 employee U.S. Subsidiary of about an 80,000 employee global energy services company. If the lights are on in your building right now and your air conditioner is working, there's a 1 in 3 chance that we're responsible. So we produce, we have all types of energy solutions, power turbines, we service it, we produce power grids, and we'll be increasing our footprint in renewables, hopefully over the next couple months. So that's what Siemens Energy does.
Great. Anthony, let's hear about Alight.
Thank you, Jennifer. My name is Anthony Marino. I'm Vice President of Strategic Accounts with Alight Solutions. Alight is a human capital business partner to some of the most influential companies around the world. We service 70% of the Fortune 100, 50% of the Fortune 500, with over 4,300 clients, serving over 30 million employees, retirees, and family members. What we do is we provide an omni-channel engagement, enterprise-wide engagement experience spanning the hire to retire employee life cycle. It's more than administration, because we leverage our analytics to create these actionable insights to drive higher levels of engagement, utilization, and consumption of the HR programs and services that organizations offer, and this positively impacts total well-being and business outcomes. Jennifer?
Perfect, thank you. And lastly, as I mentioned, I'm with Springbuk, which is a health analytics platform, and we serve over 4,000 different employers. Since 2015, we've taken advantage of cloud-native technologies to manage our clients' data in a flexible, secure, and high-performing manner. Today, we manage over 10,000 different data feeds per month, providing data and query integrity to represent the true story of our clients' population health. We've been a proven disruptor, being able to address employers' objectives of leveraging multi-source data into smarter decision-making and strategic direction. So we extend beyond the traditional data warehousing and analytics to help you unlock the potential of your data and maximize the value of your employee health investments through data curation and direction. All right. So as Paul mentioned, we do have one poll for you today, which you should see popping up over on your right-hand panel. Our question today is, how confident are you with your ability to identify key conditions and or risk within your membership and develop targeted solutions to address them? So we have everything from no confidence as far as having very little access to data, no targeted solutions, little confidence, you are using more broad industry knowledge to develop your strategies, moderate confidence, some good visibility into your data to be able to drive some strong solutions, and then lastly here, high confidence. You could do it every day. So Anthony and Doug, curious as far as what you think we might see here within our responses.
I think we're going to see the gamut. I was just making a note to myself that since since September 28th of 2020, we've gone from B to D as a personal response. But I think I think given all the participants on here, they have to be somewhere along that continuum, right? How's that
Yeah.
for wisdom?
Yeah, absolutely.
And I was going to say where most of them are coming up, I was going to say it's more like B to C is what I would expect to see,
Yeah.
much of that being in B. So.
Yeah, I think so. Which, leads beautifully into our discussion today. And I think, you described that perfectly, Doug, as far as how you all have moved from B to D and are really harnessing data, using that to help drive those decisions and really being strategic with that. But thank you, everyone, for participating in our poll. That definitely helps, frame our conversation today. And there are certainly so many unique aspects to the program with Siemens Energy. A lot of change, a lot of complexity, certainly a lot of challenges, but we certainly know that there's been some tremendous opportunity. So, Doug, would love to hand it over to you, walk through our first few slides to give us some background to really set the stage for today.
Okay. So I'm going to go quickly from this slide to the next one and what got us here. The catalyst for a lot of this change was a spinoff. We took our 10,200 employees, U.S. employees at the time, and spun off from about a 60,000 employee in the U.S. Multinational holding company. We'd been through a number, at least one of these before in our past, so we wanted to keep our population calm, right? So a lot of things we were charged with keeping things the way they were, right? Minimize disruption, keep the business focused on what we pay people to do. At the same time, our management, a lot of engineers in our organization, so we need to understand things, right? We need to analyze things. So we wanted to go sovereign immediately, but we also wanted to be sure that we could understand better those medical conditions that were making us sick and killing us. So and you'll hear that a couple times during my presentation. So our first challenge really was to, within the legacy program designs that we had, develop our own approaches to our benefits program and to engaging our employees. Next slide, please. Okay. And we weren't making this decision in a vacuum. We had a lot going on. This was an entire benefits program replacement. So we had not only our medical benefits program and our administrative platform and our engagement platform to port over, but we had our savings plan. We had legacy defined benefits programs, pensions. We had non-qualified defined contribution and defined benefits plans. Our health and welfare plan, which included our medical plan as well as our life, disability, and all that type of thing, it was pretty complex. And we pretty much had to mirror it when we came over. And we had to bring over all the administrative support for all of those things, right? And we weren't excessively well staffed. We got a total of 3 headcount to pull all that off. So we had a lot of challenges beginning September 28th of 2020 and going forward. This type of analysis and support structure for our medical plan was just one of them. So here's our other challenges. We had a lot of people. We had 14,000 savings plan participants. We had 2,900 vested benefits participants in our DB plans. We had about another 500 in our non-qualified. So we had lots and lots of people. One of our challenges was that we echoed our parents' intent to eliminate our PPO medical plan. And so that left us with everybody moving into account-based medical plans, either an HRA or an HSA. effective 3 months after we went live. So we echoed that, and that'll turn into an opportunity later in this presentation. But at the time, we were still going through the justification for that. We did this transition mid-year, or actually at the end of the third calendar quarter. So we had to bring over deductibles, copays, FSAs, 401k balances, all of those types of things. We had to bring those over. And basically at the flip of a switch, we went live. We were on our parents program September 27th. At 12:01 on September 28th, we came over and we're on our own program. The other thing was we had to reestablish all of our different benefit provider contracts. There were 43 of them. So point is it was no mean feat. We had some challenges that were put in front of us. Next slide, please. Yep. By the way, for the people that think like healthcare underwriters, we had one more challenge that I didn't put in here. When we moved, we made our parent company 1 year younger. So they dropped a year in age, and we took those more mature employees with us. So, and that has an impact on healthcare, as it knows. Anthony?
No, everything that you said is spot on. Obviously, it's what you lived, what we all supported
Right.
in the process. But there were some other headwinds as well. Right. One is, when you look at some of the complexities that exist in the healthcare industry itself or healthcare market, it's the unsustainable rising costs, right? The financial imperative, as they say. And how do you get those costs under control? How do we provide flexibility and choice while managing those costs overall was one of the challenges, as evidenced by the account-based model that you're moving to, as well as the eliminating the PPO, right? As we start to shift risk, but then help people de-risk. So that's one of the challenges. Make it more affordable for all. The ecosystem, many companies today and most clients are looking at 18 to 20 or more, 30 point solutions, right? A very unintegrated delivery system that they have. And that fragmentation causes a lot of confusion and adds a lot of complexity. So what it does is it really impedes utilization overall. In fact, some of it's just paralysis. You start to interact and you realize, I don't know where to go, or I don't know where this is. You go from one link to another, one breaks, and then people don't engage overall. And hence they don't really truly get the value. And I know one of the key things that, as you were looking at, is we want people to consume our programs more because that creates a stickiness with us. And then the last piece that, just in the industry in general, is that the health literacy in the U.S. Is not great. We're asking these people to be better consumers now. They own more of the risk of what's going on in a rising cost environment, and yet they're not fully equipped to make healthcare decisions and make the right healthcare decisions. And as you see here, over 50% of the people regret a decision that they've made in a year. And then when you look at just initial diagnoses, 20% of those in significant conditions are actually wrong. So there's high stakes at these tables. And Doug, you were pretty well aware of these types of things, and this is something that you wanted to solve for as well.
Right. I think we intuitively knew that a number of our employees, a significant number of our employees, were maybe seeking, maybe not substandard healthcare, but healthcare that wasn't advancing their health. We knew that there were providers out there that were suboptimal or questionable. Once we got a hold of the data, we were able to prove that. But again, with all these things coming into play, it was something we knew we had to combat. We knew we had to use our data to prevent our employees from having more negative healthcare experiences like that.
Yep, and I'll wrap a bow on all of that as far as with one additional challenge, as we mentioned with the poll question, is having just the data. And then a step further from that is a data that, bringing all of that in together to be able to make those mindful decisions of where can they receive the best care, who are the best expert medical, opinions, and pulling all that information together to really, set you up for success as you're making these decisions. So, Doug, I'll let you speak to this slide specifically around, then those key opportunities that were uncovered through a lot of those challenges.
Yes, so we had some things going for us, right? We had we could support consumerism by our move to account-based healthcare. I quoted Cy Sims, for those of you that grew up in the Northeast. I used to say, an educated consumer is our best customer. We forced people to become consumers. It was incumbent upon us to give them the data to become good consumers. There's an opportunity I didn't mention. We had a relatively sophisticated, well-educated workforce. A lot of them are engineers. We have a lot of accountants and finance people. So we didn't have to push them too hard. We didn't have to jam them full of a lot of education. If we gave them the tools, they could find their way. They would engage and follow a good path. So we had that working for us as an advantage as well. We had enlightened leadership. They wanted to help move the health state of our organization forward. And that has continued. So we had a good leadership group overall, and we had a very strong and enlightened benefits administrative committee that enables these kind of changes to be made. We really got fortunate in that even though we only went live as an organization on September 28th of 2020, we were able to get 4 years of our claims history. So once we went live with Alight's data analysis capabilities and Springbuk's really intense data analysis capabilities, we could hit the ground running because we had 4 years of data. And that's important. We also had a capable partner in Alight. We were mainly using them as an administrator, right? But as Anthony went into, they had a lot more capabilities than just administration. It's an engagement tool. It's a communications tool. And it also allowed us to be a conduit to provide data to Springbuk. So we could leverage both of these organizations' capabilities to really start to get data on the health condition for our employees, and then start to use strategies to communicate with them and to start to really attack, again, those conditions that are making us sick and killing us.
All right, so we have set the stage here really well as far as I think those key challenges, as well as the opportunities that were presented as well. But as we kind of move on here as far as, where did you start in this process? So Doug, I'll have you start us off with, the choices, in partnering with Alight and partnering with Springbuk, and, kind of how you started to roll out some of these specific programs.
Okay. Well, we knew, again, we knew we had to, in some cases, we had to give employees what they needed, maybe not what they thought they needed, right? So we had to give them access to our consumer-driven healthcare plans. Drove the need for access to data for them to make choices about providers, right, and courses of treatment. But we really chose Alight and Springbuk because of the existing partnership that those two organizations had, but we also needed to have organizations that had more potential and more capabilities maybe than we were using them for. So we knew Alight and Springbuk both had advanced data analysis capabilities. We knew Alight had an engagement platform and a way to communicate with our employees to drive engagement. So those are the primary reasons that we chose Alight and Springbuk. We also knew that we had some accumulated neglect, right? We had a lot of healthcare decisions that had been made from both a company perspective as well as an employee perspective or participant perspective. not based on really good data. So we had to get rid of a lot of pent-up demand and really start to attack some long-standing health risks and conditions, right? We had to look and say, okay, we got such a raft of insight right out of the blocks. We actually had to prioritize some of these because we just couldn't attack them and implement them all at one time. We really started to identify those providers with good outcomes and those resources with good outcomes, so that we could really start to, as we identified care gaps, close those care gaps. It'll take us a little bit to make sure that that's working, but it does give us the capability to close those care gaps. And really what it does is us a way to look at our plan performance as a plan versus trying to integrate 2 or 3 different carriers reports back to us. It's the best we had, but now we've got a capability to look at the plan and figure out here's how Mr. or Mrs. Participant, you are here's some things you can do within the plan to move your health conditions forward. Started launching a bunch of different types of communications to those employees to engage them and to get them to start to move further along their healthcare journey.
So our next slide here, and this is a term I know you use often as far as defeating the status quo and really flipping the script too, which we'll get to in a couple of slides here. But talk to us a little bit as far as your approach to this, and I know we'll get specifically into how Alight approaches this as well, but kind of how you think about this in general, Doug, I think will be helpful.
Well, before we had to try to judge the effectiveness of the plan by attempting to integrate the efforts of 3 big components. We had 2 different medical plan carriers, right, as well as a prescription drug carrier. So what we tried to do was interpret those reports. And I will say our carrier partners have been stellar. This is not their fault. This is a case where we didn't have one way to look at the entire performance of all the different component members of the plan. Once we got that, right, we went from being a plan administrator to a steward, because if I look at the first 5 or 6 gaps in care that we identified, we actually knew more about the plan participant perhaps than they did, certainly than their doctor did. And each of our carrier partners would have only had one piece of the picture. So we were able to look at a participant's care history from one integrated perspective. And that the stewardship thing was a little bit of an it wasn't predicted. Once the data lit up and we could see these things, we realized very quickly we had to start communicating with people because it could affect their health if we didn't. And we were one of the few parties that had insight to that. So it turned us into a steward in some cases, and it also allowed us to take a plan perspective, which was quite a bit different from the plan management that we inherited from our parent.
Mm-hmm.
So,
Doug, I remember, and when you talk about being a steward, I remember the conversation right before Christmas when you sat down and you really challenged all of us in the room. You said, look, we know who they are. We know the people that need help. They go home on holiday right now and someone strokes out, that's on us. And that right. Really became a salient moment in terms of how you were viewing it and your sense of stewardship overall. And then also the recognition of the impact that we truly can have on individuals and family members and, all employees for that matter.
And it's a delicate line to walk, right? Because you could be a steward, which is the way we approach it, or it could be viewed as big brother. So we got to make sure we take the high road on this one and the stewardship approach. Right. So you, Jen, and you, Anthony, and our partners that we hand these off to communicate know who they are, but I don't. I know how many there are. I know they're in our plan. We don't know who they are. But the right people have to know who they are so they can communicate with them to move their health conditions forward.
Yep. And that actually, we just had a question come through. I think this is appropriate to answer at this point in time. So the question is, how did you overcome HIPAA compliance in terms of getting this holistic view of your user's health history? Anthony, do you want to start off answering that as far as how you all are obtaining the data, and I can add in the Springbuk components.
Yeah, we received the data from the carriers, so we have the claims information. We know who the individuals are, but that information is not shared, and it's not shared directly with Siemens Energy either. The way in which we interact with, or you could say nudge, participants is really, you're sitting there saying somebody hasn't seen their general practitioner in a year. They may get an email then that sits there and says, keeping up with your primary care. For help, call your health pro. You want to set an appointment with your general practitioner. You get something along those lines. They're little nudges. It's kind of like that Netflix, Amazon type thing, right? They'll see it enough here and there, and then ultimately they engage. They'll see it on the website. Again, little nudges along those lines, but it's nothing that's calling them out and saying, hey, look, we noticed you didn't take your statin this month. It's time to take it. You have diabetes. No, it's not that overt or in your face, but it's more subtle recommendations and nudges that drive the level of engagement.
Yeah. And in a similar fashion as far as with Springbuk and the data that we receive, whether that's coming from Alight or from a carrier directly, again, same type of fashion as far as, we're receiving the individual level data, but what the employer sees is at that aggregate view. There's no PHI disclosure at that point in time, but it's used to power solutions like Alight has in place as far as those components, as far as the outreach and how we think about engaging people within the system. All right.
So, from an employer perspective, I'll give my statins. That was really the one that we were talking about over the holidays. We had 155 people who should have been prescribed a statin and did not get it. That poses a health risk. Diabetics who take a diabetic medicine and also needed to be prescribed a statin and they weren't, right? Part of the frustration was we were moving kind of slowly. This was our first one. We were moving kind of slowly. So, at one point, because it was only 155, I was going to send them individual letters, but can't do that, right? We have to keep an arm's length. We have to get the information into the hands of people who can act upon it. So it come from Springbuk and then go to Alight for communication. All I can know is that there's 155 of them, but they should be getting a communication to tell them they need to do something. And so it's important to maintain that arm's length relationship, even though it's sometimes in order to get action, sometimes I had to keep backing myself off to get them communicated with. Anthony, you want?
Yeah, repetition makes a difference. So, right. So then what Doug ultimately and Energy as a whole said, right, we need an engagement platform that's going to drive these type of behaviors, right? That is going to improve overall engagement. So the Alight Work Life platform is that enterprise-wide portal that I talked about earlier that spans the hire to retire life cycle. But by the way, it has a developer's portal and some common underpinnings, which makes it easy to integrate not just our capabilities into the experience, but the capabilities of other third parties to provide that more holistic experience for employees. At the bottom, you have the engines, the core administrative engines, and other third parties. And then we have a data lake in the middle. In that data lake, we're able to pull data out of those core engines, and we leverage our analytic capabilities and the capabilities of Springbok to kind of now notice what's going on, right? And as we see things that are, we create actionable insights from what we see. And then from those perspectives, then we engage the employee, the employee or the family member in a fashion or interact with them in a hyper-personalized fashion, right? So right time, right moment, right place, whereby they then engage, they utilize, and then they consume whatever it is that we might be doing. And this spans total well-being. So somebody could be getting an increase in pay, and yet they're under contributing to their 401k. They might get a notice along the lines of maximize your 401k match. The web itself will reorganize itself such that maybe that might be one of the more prominent tiles that they'll see. It may be more one of the things that's front and center on the IBR because of these benefit smart routing, which enables the IBR to also be agile along those lines. I talked about before about preventive care and suggestions that people would get with that. If we see that somebody hasn't had a mammography in X period of time or hasn't seen a general practitioner, they're not keeping up with their preventive care. And that's what drives levels of engagement back. So this platform is set up to operate along those lines, to provide that level of integration, drive those hyper-personalizations out to the individuals, and then to impact overall engagement. So what we did, next slide, please.
Hold on. Can I throw in a point here?
Absolutely, please.
Anthony? Okay. So I talked earlier about fully utilizing the capabilities and the potential of our partners, right? If you look at step 4, really that's how we were using Alight. It's only once we started exploiting their additional capabilities, including the rather significant one, which represents access to the Springbuk engine and the capability to feed it back and forth. If we only used them as an administrator, we wouldn't be making this presentation today. It's only once we started utilizing the heightened capabilities of Alight and Springbuk that we were able to really start to move the needle forward in terms of our healthcare outcomes.
Yeah, and I would just add, we've got Springbuk added on to point 3 and point 2 there. And you mentioned, Doug, as far as, the power of the analytics that Alight is doing and the power of the analytics we're doing at Springbuk, and you combine those and you make some really powerful insights, again, to see where you are today as far as with the value that these programs have brought to your members, which I know we'll get into kind of the outcomes here shortly, but again, it just goes to speak to the whole holistic approach to this data and being able to take it in from all various sources and use the potential from that aspect as well. Back to you, Anthony.
As Doug said, Springbuk puts hyper-personalization on steroids. So here's the model that was deployed for Siemens. And we talked enough about the data on the right-hand side and the hyper-personalization and the analytics that Springbuk brings to the table. But I think what's important about this is this really helps people navigate the complexity of healthcare, right? The complexity of their total rewards for that matter. There's one number that they call. They get one number to call, one site, one website that they go to. They have one person. They have a dedicated health pro, minus Savannah Smith, and she's awesome. So I get one dedicated health pro that anything I have or want from a total rewards perspective, a healthcare perspective, we just recently moved to Tampa. I need to get a new general practitioner. Ask Savannah, give her my zip code, say this is what I'm looking for in terms of certain qualities. And the next day I have 3 recommendations based on quality and cost in network capabilities. So
and if I may, that
Yep.
recommendation is made using the combined insight of your data analysis, Anthony, with Alight as well as Springbuk's data analysis. So it's a constant refresh of that data, which help refining the quality of the provider data that we're able to help employees access.
Absolutely. And then I think the last thing that I would say here, so we talk about one number, one site, one person. Now you have one card. So Siemens Energy deploys the Alight Benefits card, which has all the carrier information on it, the medical carrier, the dental, vision, EAP. So it has all the necessary numbers, phone numbers. They can bring this into the doctor's office. And then it also has their Benefit Pro phone number on the front as well for any questions that they might have relative to the benefits that they're receiving.
Okay.
So it makes it very, very simple for people to engage, and that's why we get the results as a team here, why we get these results that we get in terms of utilization and consumption.
And one of the things we have to, once you start analyzing this data and maybe implementing a bunch of solutions, one of the things you don't want to do is overwhelm your employees. You don't want your front door call center to say, if you have diabetes, push 1. If you have musculoskeletal problems, push 2. So you have to look at the analysis and the fixes that you implement for these different conditions and make sure that you don't inadvertently drive them all over God's half acre to get to those solutions. So you have to continue to strive to have one access point for as many of your programs as you can. Otherwise, they'll get good quality healthcare, but they'll be distracted by having to figure out where to get it from. So again, that single access point is key.
All right, so we'll keep moving along here. As we think about flipping the script, Doug, I'll let you speak to this slide in particular. I know we'll get into some of the specifics around like the access to the data, but in a similar fashion to, breaking the status quo, would love to hear how you flip the script.
So what we realized was both as plan administrators, now stewards, right, as well as participants in the plan, we were sort of slaves to it. Now we've got data, and we've got data to help figure out the strategies to address our conditions, but we've also got data to arm our employees with to be better healthcare consumers. That's a whole new role, and that's really what we talk about in terms of flipping the script. The other big thing that having all this data in one place does, and I said it before, it gives us the chance to talk to people, to our participants, and to our partners that are in the healthcare plan as a plan. It isn't trying to manage a whole plethora of providers. Now we can start to say, here's the plan, here are its goals, here's how you, carrier A, can do it, here's how you, carrier B, can do that. So we can start to actually treat our partners like true partners and almost like employees. We can say, here's what you need to do. Occasionally, here's how you do it. Here's how you did it, how well you did with it. So it really allows us to in a collaborative manner, again, flip that script and start to speak as a plan. And it also changes the way we consume healthcare, because we can start to drive our participants voluntarily, willingly, into those providers that have good outcomes and have better prices. So over time, we can start to even maybe make some additional purchasing decisions based on that.
Yeah, definitely. And I think, just to emphasize the point as far as thinking about this from a plan perspective. So it's, the polls show we probably have a lot of individuals today that are using carrier reports or using individual vendor reports, which if that's all you have, that's all you have. But it's very difficult to get that full picture of how the plan and ultimately the population is doing. So we're really moving, and trying to help employers manage their investments properly, just as you've been speaking to be able to take that proactive approach to their data, to their employee health, and to their programs. So what we are specifically looking to do is really help identify those strategies that best optimize the plan. So then you can put the right programs in place that are specific to the unique needs of your population. And that may not necessarily be, for every single individual, but you may have pockets of individual populations that you need different programs in place for as well. So all to really ultimately help you make the move from this stagnant reporting perspective to be able to have this kind of interactive experience as far as with your data that can really tell the story and make that directional for you as well. And I know you have a couple examples here that we can flip through as well.
This was what we originally had to tell us what we were spending in terms of our healthcare plan. So we didn't get a whole heck of a lot of insight, right? We knew we were spending a lot of money with our two healthcare carriers. And if we go through our quarterly or our annual reviews with them, we get some more insight on it. But again, we'd have to try to Rosetta Stone it all back to how it fit within the plan. And we had to try to, we didn't even have a common format for the business reviews from the carriers. This is that's one of the things that this process will give us is a common format for that. So we went from basically a cost report to now about once a month to get an update, and it says your Springbuk data has been updated. So, and we get to see this. So we can see these are our opportunities right here. These are our gaps in care. It's 3 across and 18 or 19 deep. So now we can say, okay, look, of the $120 million we spent on healthcare, you could reduce your healthcare. You have $819,000, for example, of opportunity by changing the way you have your employees approach coronary artery disease. I just put in one example here of the detail. It's on diabetes. You don't just get a number and say you've got $3.25 million in opportunity. It's spelled out how you can implement those changes. So you go from, I know I spent a whole lot of money among these 3 providers, to here's what my plan spent, and here's how we can implement strategies to start to attack these conditions and the costs associated with them. Next slide, Jen. And so we know we spent a lot of money on drugs, but we don't know what it went to treat. So now we see where our different expenditures were in terms of prescription drugs. So it really gave us a lot of insight and actionable things that we could implement to start to attack our conditions, our chronic conditions. Okay, so, and this is, so we can, if we take that a step further, we get our reports from our carriers, and it would say, okay, we know we've got diabetics, we know you've got people with musculoskeletal, we've got mental health, people with mental health, we know we've got cancer. It's the stuff that hurt, making us sick and killing us. But we had to try to figure out a way to communicate with them. Now we can get these, we can identify those conditions and communicate with them on a monthly basis. So not only, hey, how's your treatment for this going, but also, hey, it looks like you spent a lot of money on medical. How can we help you? You haven't seen a doctor since the 60s. You need to get in and see them. And here, if you don't have one, here's we can help you make some recommendations. So again, we've got a series of kind of canned conditions that we're always communicating with using the capabilities of Alight and Springbuk.
All right, we've got about 10 minutes left today. I want to make sure we certainly speak to, the measurement, the value, your return on investment here. So I'll let you kind of roll out with these last few slides here, Doug, because I think this, again, is really important. When people think about putting programs in place. They think about connecting all their data together.
Mhm.
But now what are you seeing? How well is that working? And what are these outcomes that you're really, seeing for your population and what that means?
Well, I mean, we know we're starting to turn the corner. We know we're starting to positively affect trend. We're as we go through our setting our rates for a 2023 plan year, we see the effect that analyzing the data and implementing strategies is starting to have on it. We're in the infancy of it, but we've got the data now. We've got the specifics now to begin to drive our folks towards better health outcomes. So, and we can measure it. We can say, okay, we talked to this person in February, made a recommendation as to a healthcare professional. They went to them in March. Now we can extrapolate out what their costs are and what their outcomes are using Springbuk data. And we can really start to show how we're moving the needle forward in getting a real stronghold against these conditions that are making us sick and killing us. When you have data, you can have a dashboard. We didn't have any way to generate a dashboard in the past, so now now we have that, and that's we can take all this boring geeky stuff that I'm talking about and put in pictures that we can present to our employees and to our executives, and it's powerful, right? And we're getting very good uptake on the different programs. So I'll let and that's different for every employee. But if you jump to the next slide, I'll let Anthony talk about that, or I'll talk about it. All right. So we're one of the highest utilizers of your Alight tool, Anthony. Right. We've got a pretty high Net Promoter Score, and we had some ROI goals that we have exceeded pretty significantly in our first 15 months of implementation.
Yeah, and I would just add there, Doug, I mean, we target roughly 100% utilization on our journey together.
Mm-hmm.
You know, when you look at 57% utilization in 1 year during a pandemic, right? I mean,
right.
where people aren't consuming as much healthcare as they will be. That's a tremendous impact that we've had, and that's a credit. Honestly, I think one of the things, not to overstate something here, and maybe it's coming through, it's the partnership that the three of us have. And the way in which we, very transparent with the information, and we collaborate together, and we get the data, and then we're able to build these campaigns, these type of personalized campaigns or other communication strategies in order to have positive impact on the total well-being of the energy employees.
Yep.
Absolutely. Well, I think that takes us to one of our last slides here as far as kind of what's on your roadmap of what you're doing next. What are the next challenges you're looking to take on from here?
Well, I mean, we continue to go after those gaps in care. Every time the information updates, we get a new set of those. So we identify those that we continue. We've made it a goal now to address 2 or 3 gaps in care per quarter. Analyze them, identify them, figure out how to communicate with them, and then do it again, because it will measure itself, right? We know we can do that. So identify those gaps in care, continue to identify those gaps in care, and communicate with those affected. We also have these high-level programs where the analysis tools find the folks that have diabetes and cardiac and start to and a whole bunch of other conditions, about 13 different situations, and continue to communicate with them as they surface, and we can start to utilize our different either data analysis or navigation tools to help them seek optimal care.
One point, just to even add, so this isn't all single-threaded, right? When we create these campaigns together, they're prioritized, but they're constantly running all the time. So what's relevant to somebody, they will see a campaign at the highest priority. If they don't engage with that campaign over a short period of time, then they'll see a secondary campaign against a secondary condition. or a set of circumstances that have been put together. So I think that's part of the magic of it in terms it's not a single threaded piece where it's just one message at a time over a period of time. It's multiple messages appropriately displayed to each individual, specific to them.
Right.
Well, and that it's updated every month for you as well. Risk never stops. So there'll always be gaps in care. There'll always be people at risk of various chronic conditions. And so there's always opportunity there. But to your point, Anthony, it's so multi-threaded. And one individual may only be flagged for one campaign, but you may have one that's flagged for 5 or more, which makes it such a unique experience.
Yep.
When we launched those campaigns, I think there were only, of our 10,200 employees, I think there were only 9 total that didn't get some type of campaign. Many got multiple campaigns. So, yeah, you're right. I mean, it's multimodal, but it's also, you're getting a bunch of messages depending on your own health situation.
But again, just to say it, they're prioritized. Like if you were up from 5 of them, you wouldn't get all 5 at one time, right?
No,
You would get the highest priority. And then if you don't engage with that, then you get the second highest priority at another point in time. And, it just keeps on cycling, as Jen said.
And then over time, probably one of the most important things we're going to start to do is, while we've got employees in, I think, all the lower 48, but we've got concentrations in places like Texas, North Carolina, South Carolina, Florida. So we want to start to identify those providers in those areas where we have big groups of people. We want to start to identify those providers that are handling our conditions with the best outcomes and the lowest cost. Not necessarily lowest cost, but best cost. So we're going to continue to refine our network of providers. We're not going to get into the medical network business. Don't get me wrong, but at the same time, we can develop our own subset within our carriers' networks of those providers that are able to help our employees advance their healthcare situation.
Very good. All right. We do have a handful of questions here. All right, I'm going to combine a couple of these together. And Doug, this will be for you, but Anthony, I think the second question here may have some for you as well. So how did you pick gaps in care for your outreach and your nudges? And then the second follow-up to that is, do you ever feel like you're pushing too much onto the employees too fast, as far as addressing 2 to 3 gaps in care per quarter? Could seem like a lot that could turn off employees and cause them to disregard messages.
Well, bear in mind, when we first started, we had our gaps in care represented 4 years of history. So we had to kind of clear that backlog up, right? So we really selected, we very quickly saw we had about 5, maybe 8 conditions. So that were our primary cost drivers and what was making our employees sick. So focused on the gaps in care that we could exploit were those 5 to 8 conditions. And it was diabetes, it was musculoskeletal, it's obesity, it's all the diseases of prosperity that goes with a well-paid, well-benefited older workforce. So we just picked the ones off the chart that we could see and just started to go after them. In terms of overwhelming people, that's a concern, right? So what we had to do was make sure, again, we talk about that we had a common front door for people to access their care, not access their care, but access information about their care. And not everyone got everything. And our diabetics may have gotten something, and again, through the prioritization process that it's a heuristic that Alight and Springbuk have given us to use. So we're able to say, it's one thing if you've had high healthcare costs, but your cardiac condition trumps all that. So that's the thing we're going to be contacting you about the most often and the most urgently. Mm-hmm. So we start to prioritize just based on the imminence of an untoward health outcome if you don't. But yes, the duplication of message, how pervasive the messaging is, Those are all things that when you get into managing your plan this way, you have to watch it. You don't overwhelm your folks.
Right. Yeah, and not much to add to that, Jennifer. And we talked about it before. It really comes into the prioritization. It's not moving from one message to another. We sent one today. We're sending a different one tomorrow. There's weeks in between, but it's just a constant recycling such that, and they're not getting bombarded just with emails, right? It's not an email-driven approach. I mean, they'll be on the website and the way the website presents itself. So somebody goes up to their 401k balance, and they might sit there and say, preventive care. Get your preventive. Make sure you do your preventive care, or have you contributed to your 401k match? Or maximized your 401k. They'll see those types of things that just create them, a nudge. It's not intrusive.
Right. And for things like preventive physicals and health risk assessments and eye exams, you're missing an opportunity at another $150 in your health reimbursement account or your HSA by not getting a physical. So it isn't get a physical. It is you get something for it. So we've tried to shape those messages a little more.
Yeah. Very good. All right. Well, I think that's about all we have time for today. Thank you, everyone, for joining us, and hope you have found this informative. And Anthony and Doug, thanks so much for your expertise on the call today. Really appreciate the partnership and continuing to provide Siemens Energy with all the great data that you have, and love to hear about all your programs. So thank you again to everyone for joining us.
Thank you, Jennifer.
Thank you, Jennifer, for this opportunity, and thanks to everybody who attended. I appreciate you hanging in there with us.